The Patient Protection and Affordable Care Act by Team 6, narrated by Melissa. The Patient Protection and Affordable Care Act, PPACA, was signed into law by President Barack Obama on March 23, 2010, thus creating the most significant piece of government healthcare legislation since Medicare and Medicaid. The goal of the PPACA was to expand health insurance coverage for all Americans, as well as make purchasing health insurance accessible despite having a pre-existing condition, the loss of a job, or loss of coverage. Though the act is still relatively new and has some kinks to be worked out, it signifies hope for American healthcare because it is moving forward from a broken system. There are several provisions that will be taken into effect within the PPACA. These provisions allow for improvements on quality of care, lowering healthcare costs, access to healthcare, and new consumer protections. The provisions will be phased throughout the years, with the majority of them becoming effective as of 2014. The provisions include the expansion of public programs, the health insurance exchanges, changes to private insurance, the individual mandate, employer requirements, and the 10 essential health benefits. The expansion of public programs expands Medicaid to 133% of the federal poverty level for individuals under the age of 65. This new minimum for Medicaid eligibility eliminates a limitation of the program that prohibits most adults without dependent children from enrolling in the program. The health insurance exchanges allows for individuals who do not have access to public coverage or affordable employer coverage able to purchase insurance with premium and cost-sharing credits in order to make coverage more affordable. The changes to private insurance include a revised medical loss ratio, which requires most insurers to spend at least 80% of premium dollars on enrollees' medical expenses, preventing insurers from denying coverage to people for any reason, including health status and gender, and extending dependent coverage till age 26. The individual mandate requires that most individuals have to have insurance by 2014. Those who opt out of coverage will be required to pay a tax penalty, which will increase year to year. Employee requirements, which penalizes employers that do not offer affordable coverage to their employees, with the exception of small employers. And finally, the 10 essential health benefits, created by the PPACA to address limitations that result in inadequate health care administered to patients. The essential benefits are ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, prescription drugs, rehabilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, and pediatric services. The PPACA includes 3 regulatory programs: risk adjustment, reinsurance, and risk corridor. The importance of these programs is to prevent adverse selection and risk selection and work together to stabilize premiums during the initial years of the PPACA. The risk adjustment program is the only permanent program of the 3. It protects against adverse selection and risk selection by having lower risk plans make payments to higher risk plans. The reinsurance program is a temporary program in place from 2014 to 2016. It protects against premium increases in the individual market by offsetting the expenses of high-cost individuals by issuing a payment to enrollees whose costs exceed a certain point. The Risk Corridor program is a temporary program in place from 2014 to 2016. It aids in stabilizing and protecting against inaccurate premiums by collecting funds from plans with lower claims and making payments to plans with higher claims. The implementation issues concerning the PPACA include the market structure of the PPACA, financial costs, and the quality of care. In order for the Act to be successful in expanding health insurance coverage, all of these implementation issues must be addressed equally. The PPACA is structured so that there is choice without complexity. It accomplishes this by laying out 4 different healthcare packages: bronze, silver, gold, and platinum. However, while there are a variety of choices for health insurance, there may be some limitations included in fine print that may exclude some consumers. For example, The PPACA includes a 10 essential health benefits provision. However, if a consumer has a health condition or illness that does not fall under one of these 10 benefits, they may be subject to exclusion. Therefore, the PPACA needs to provide customized options for its plans in order to satisfy each individual's needs. In addition to making healthcare plans more complex, the cost and quality of healthcare needs to be addressed. The growing cost demands within the U.S. healthcare market are unrealistic and unsustainable. With the expansion of Medicaid, the government will find it difficult to keep up with the funds for the program, and the patient to medical staff ratio will increase. The government has addressed methods in order to allocate funds for the program. However, not much thought has been given to the medical staff shortage. Therefore, some of the government funding should move towards medical schools so that programs can expand, educate students adequately, and help students graduate at a faster rate. If a solution to increase the medical staff cannot be found, it is the patients that will suffer. A significant case revolving around the PPACA was the National Federation of Independent Business v. Sebelius. The litigation primarily focused on two of the provisions, the individual mandate and the expansion of Medicaid, claiming that Congress had exceeded its constitutional powers. However, despite the arguments against the PPACA, the Supreme Court decided that the act was indeed constitutional, ruling that Congress had the power to require individuals to acquire health care insurance under Congress's taxation power. The following slides will demonstrate the various titles and sections within the Civil Rights Act through the use of Barbie and her friends. Maria enters the hospital. However, she only speaks Spanish. Dr. Ken does not want to spend extra for a translator and wants to turn Maria away. However, Nurse Barbie insists that this is wrong because according to Title VI of the Civil Rights Act, Dr. Ken can't discriminate based on race, color, or national origin because they work in a hospital reimbursed by Medicare and Medicaid. Barbie's department manager gives her a pay raise. Christy is upset about this because she has worked longer at the hospital and feels that she is just as competent, if not even more than Barbie. Christy accuses her manager of violating Title VII of the Civil Rights Act, which prohibits discriminatory employment, which applies to not only promotions, but dismissal, discipline, terms and conditions of employment, and job advertising. Nurse Christy signs a contract with Kaiser before initiating her work. After a year of work, her supervisor sits her down and terminates her based on tardiness and refers to the termination clause on the contract. Christy knows that the hospital is trying to cut back on employees and hours to make ends meet, and claims that she has not been tardy more than 3 times, unlike Barbie, and accuses her supervisor of being racist and plans to sue the hospital under Section 1981 of the Civil Rights Act. Dr. Ken works at San Francisco Hospital, a hospital reimbursed by Medicare and Medicaid. He receives an incentive from SF Pharmaceutical when he writes an X amount of prescriptions. Dr. Ken is slammed at the office today. Lindsay comes in with a UTI, so Dr. Ken quickly prescribes her an antibiotic and sends her on her way. Upon taking the antibiotic, Lindsay gets severe diarrhea and is admitted to the emergency room for dehydration. Lindsay is trying to sue for the hospital bill, claiming that Dr. Ken under Section 1983 misused his medical authority by prescribing her such a strong antibiotic for a UTI without checking the severity of her infection first. Chelsea comes in for a yearly physical with her new doctor, Dr. Ken. The routine goes normally. However, Dr. Ken conducts a breast check to check for cancer. Chelsea feels that Dr. Ken sexually assaulted her because a breast check was never part of her physicals before. Chelsea wants to sue Dr. Ken for emotional distress. However, her lawyer insists that she cannot solely sue Dr. Ken. She has to sue the hospital he works for under Section 1985 of the Civil Rights Act, which forbids conspiracies to interfere with civil rights, including deprivation of equal protection of the laws or equal privileges and immunities under the law. Thank you for listening to our presentation on the PPACA. Like, comment, and subscribe. Stay tuned for, there are no more presentations after this.